Hopefully you can hear me well. Um, Figured talk about what most of us is going through, besides being drained all the time and in pain. A lot of our doctors say that sarcoidosis doesn't cause pain, but there's 1 million patients dealing with sarcoidosis disease, and we all experience pain. So that should tell the doctors that sarcoidosis does cause pain, because we're all suffering with it. And it also causes us to be drained and tired. But again, doctors don't want to listen to their patients for whatever reason. And we can tell them till we're blue in the face, and they'll still tell us that sarcoidosis doesn't cause any pain. And they'll still tell us that it's because we're on prednisone. And prednisone causes water weight. Why I'm so big. And that's because we're obese now. That's why we're tired. And we're having trouble breathing. And why we're in so much pain. But there are sarcoidosis patients that refuse to take prednisone. And they're constantly drained. And they're constantly in pain. So that should tell the doctors it's not just because we're on prednisone or whatever. Sarcoidosis does cause pain. And I wish doctors would listen to their patients more. And maybe they'll learn something. Something that they don't know yet. Just listen to us. We're going through sarcoidosis. We know our bodies. But, again, either because they have a medical field and have been doctors for however long, they don't want to listen. So how do we get them to listen to us, their patients? Because if it wasn't for us, they wouldn't be getting paid. They wouldn't have a paycheck. I don't know how to get our doctors listening. But they shouldn't make it where their patient's telling them something's wrong, and this is the cause. They shouldn't make their patients feel like they're crazy. Like their words don't matter. Like they're nuts. No doctor should make their patients feel that way. I leave my specialist office most of the time feeling like I'm crazy. Is it just me? Is it all in my head? And so I go into the groups and ask. And I find out, no, it's not all in my head. I'm not the only one going through this. We all are. We're all drained. We're all going through the same pain, the same symptoms. And we have sarcoidosis in different areas of our bodies. And not all of us are on prednisone. And not all of us have water weight. Just the ones that are on prednisone. We all have trouble breathing. But how do we get our doctors to listen to us? It's not easy just to switch doctors, especially if most of the doctors never heard of the illness or don't know anything about this illness. So it's easier said than done. But there has to be a way to at least get them to listen. And I think doctors that have patients that have sarcoidosis should have to take an online seminar to learn about this illness from other scientists or other doctors that are experienced in this field. if a new virus or a new medical breakthrough comes through, doctors have to go to school. They have to learn about it, correct? Yes. So why not with sarcoidosis? Why can't they do an online seminar? Doctor or scientist that has experienced and only sarcoidosis, that only knows of the way it affects patients in every aspect of their life, their body, everything. I think it should be a must. And I think it should be where if you want to be a specialist, and whether it be lungs or whatever, and sarcoidosis affects every part of the body, all organs, nerve system, muscles, bones, your skin. There's not a part of your body that it does not attack. So I feel if you are a specialist with eyes, lungs, whatever it is, you should be forced, not given an option. You should be forced to learn about sarcoidosis, especially if you're a specialist. And if you don't, then I think you should have your license suspended for a while until you get those classes taken or the seminars taken, and then you get it back. Because you're a specialist. Like, I see a pulmonary specialist for my lungs. And you had to go to college for many years to be a specialist. You had to go through a whole bunch of steps. I think this should be one of the steps. And granted, if you're just a regular doctor, you're important too. Just as important. And if you want to learn about sarcoidosis, then I think you should be able to take the seminar too. And it should be recognized that, you're taking it on your own behalf. And like my regular doctor, I'm pretty sure I'm his only sarcoidosis patient. But he's actually done some research about this illness. I think there should be a seminar for anyone that wants to go and learn. But if you're a specialist, should be, and you're a doctor, there should be a class that you sign up for online and of course pay for. And then if you're like me, a patient, or have family members, then there should also be a class that you can sign up for and learn more about this illness. Just think, if our families knew and understood what we're going through, maybe we'd have more compassion. Maybe we wouldn't lose as much family. And again, maybe we would. Maybe we'd lose even more. Who knows? But I think that for the doctors and the specialists, it should be mandatory. Something should be done to learn more about this illness and what your patients are going through. Because again, doctors shouldn't make us feel like we're losing our mind, that we're crazy. There's something wrong with us. No, listen to us. We know. I deal with this pain every day. Every day I fight to live. And every day, not every day is a bad day. But there are days where the pain's horrible. And I just want to give up. Just give in to the pain. But I don't. I keep fighting. And all we want from our doctors is just for them to listen to us. A lot of times, they don't even do that. They just write it off. Oh, it's your medicine you're on. Oh, it's because you're obese. Oh, it's because of this or that. That's not the case. It's not. Alright, well, that's all I have to say. God bless you, and I hope your day is better than mine. Bye.